In this video, I'm sharing with you how to progress on a walking program for lower back pain. This is a video for anyone out there that has lower back pain and isn't sure what the next step is to say from walking to running. So stay tuned, this is a video you're not going to want to miss. Hey, what's up YouTube? It's Coach Remy here. In today's new video, I'm sharing with you how to progress on a walking program for someone with lower back pain. When it comes to someone with lower back pain, often I'll get asked questions, hey Remy, I'm doing a walking program. What's my next step forward with my low back injury or my low back pain? How do I progress to say something like running? What are the steps that I have to take to get there? Well, with this video today, I'm going to be sharing with you ways that I would consider progressing a client on a walking program to the end goal of, say, running. And there's many steps in between, and running, you do not want to rush to it right away. And it's really going to depend on the context and the individual's back pain. But let's jump into it with step one. So step one is working within your walking tolerance. So when we take a back pain client, or when I have a new back pain client, one of the first things I'm looking at is their technique. We want to first optimize their walking technique, making sure that they're walking in a fluid motion and a spine-sparing way, where they're not putting extra stress on their low back. So we're looking for long strides, an arm swing, their chest is tall and their head's not poking forward. So one of the things I will be doing is working with the client to make sure they have proper technique when they walk. And then from there, I will then prescribe different durations and frequencies for the client. Now the goal is for them is to walk within their tolerance. So for example, maybe we'll start with 3 15-minute walks. And if they can handle 3 15-minute walks, maybe we then progress to 20 minutes and so on. But if it isn't, they can't walk for 15 minutes, maybe we have to regress to 10 minutes. We have to find what that threshold is, and we want to stay on the conservative end and below the tipping point. And each individual's tipping point is going to be different, but we have to identify that first and walk within that tolerance, and then slowly build up some capacity to walking. And then eventually we can progress to step two, which is incorporating greater durations and frequencies. So now we're maybe going for more frequent walks. Maybe we're going for 4, 5, or 6 per day of maybe 20 to 25 minutes per walk. And then we're just continually building up on that, where we're going to be playing with those variables to the point where maybe we can walk a full hour without back pain. And then once we get to that step, or we complete that step, we can then go into step 3, which we can maybe incorporate some stair climbing now. So maybe we incorporate the individual doing or walking up a flight of stairs or multiple flights of stairs, or continuously repeating that for a certain period of time, or maybe incorporating that with the walking aspect. So maybe they go for a straight walk for 20 minutes, then they walk up a couple flights of stairs, do that a couple times, and then continue walking. Now we know when we do stair climbing, there's a greater ground reaction force compared to walking, so there's more loading on the spine, in which we're challenging the individual. Once from there, depending on how the individual responds, we can then move to a next step, which could be walking backwards up a hill. Now when we're walking backwards up a hill, we're now incorporating more glute activation, and we're working a little bit of hip extension for the individual, and we're challenging the individual's overall lower body endurance in a different way. And if that individual, if they respond well to some backwards hill walking, we can then progress to, say, some forward hill walking. So we have them walking just straight up the hill, where we're now working more of the quadriceps, the front of the thigh. And then from there, if they respond well to that over a period of time, we can then maybe have a discussion where we can now progress to a form of jogging for a short duration. Maybe it's 5, 10 minutes, and then just engaging in small multiple exposures and building up on that over time, depending on how the individual responds. So that's just a general overview of how I may think about progressing a client on a walking program for someone with low back pain and building tolerance, eventually getting to the point where they can jog and then run. So it's definitely a process, and each individual is different, and there's going to be certain exceptions in certain cases where maybe there's an individual that we progressed a lot on walking, and they can almost maybe jump right away to running. It really depends on each individual, but there's different exceptions in different cases. But that's just a general overview, and it's baby steps basically wins the race. We want to slowly progress to the point where we're comfortable and we've built up a capacity pain-free to now where we can do more vigorous activity. So that's kind of the end goal for the individual with lower back pain. And that's just a little overview of how you may think about progressing on a walking program. And if you're a little bit unsure about this, a walking program, I highly recommend you seek out a skilled practitioner, maybe a McGill Method practitioner or clinician, to help advise you on your walking program, to give you specific recommendations and guidance on how to progress for yourself and where you should at least maybe start at, and then you identify kind of your end goal and work towards it. So I just wanted to share that with you guys to give you a little bit of an idea of how to progress on a walking program from, say, the start of walking all the way to progressing to, say, the end goal of running or doing a form of jogging. So keep in mind, and we may keep each individual in a little 2-week kind of micro cycle, and then eventually kind of build upon that depending on how they respond. And then the exposures, we may increase a couple minutes each walk or each run or each stair climb, whatever it is, depending on how the individual responds. So if they respond well to a higher threshold, then we can continuously kind of add on and add on. We just want to make sure we're cautiously progressing and we do not reach that tipping point, rather we're staying under it comfortably and we're taking the conservative approach and baby steps till we get to that end point where we want to be pain-free and doing those vigorous activities, say, such as running, as one may want to do. So that is just some information I wanted to share with you guys. I hope this video gives you a little bit of a context of how to progress from walking to running. And if you have any specific questions, please be sure to leave them below in the comment section or reach out to me personally via email. And also, just before I wrap up this video, guys, if you want more back pain information or tips, be sure to join the Facebook group, the Back Pain Warriors. There's a link in the description below that'll take you to the Facebook group. And then you can ask to join. And then from there, you'll find a lot more information, more specific information that I'm sharing and others are sharing about their own personal back pain journey that you may find helpful. So with that being said, guys, that is a wrap. And until next time, have a successful and productive day. Take care.